Dear doctor, here are the top 5 scams that you should be careful about. Number 1, the army camp scam, which is usually some person posing to be as part of a particular organization and asking you to conduct a camp for too many people. What one needs to note here is whether it is the army or a government organization or some company, there is usually a due process and diligence that happens, and there is a vendor, and an individual doctor would not be randomly contacted for it. Plus, you should not be the one paying any fees for such a camp. Number 2, an officer of a particular government department like biomedical waste or some municipal organization comes up to your clinic and alleges that your clinic is flouting certain norms, whether it's some random collection of needles or cotton swabs which should have been disposed, or the board outside your clinic is not right. This usually happens to migratory doctors, people who have recently opened their practice. The scamsters are well aware of who's new in the area and who started recently and tend to target the newer doctors than the older ones. To protect yourself, be registered with the AMC body or the local IMA branch, and as they provide good assistance to help doctors with their compliance. Number 3, the dropping a parcel scam. Often we receive many things at our clinic, including sometimes medicines or surgical instruments and the like. Scamsters keep track of this and then one day in your absence pretend to give something that you had ordered to your staff, receptionist, or to your next door neighbor or the shop next door, and insist on a particular payment, saying that the doctor asked them to deliver this and collect a payment. The only way to avoid this is to make sure there is a good chain of command and not give cash for any parcels as a blanket rule. It ensures nobody loses money and somewhere the scamster is forced to interact with you and you can nip the problem in the bud. Number 4, MLM scams. These appear as innocuous nutritional supplements or some product that would benefit your patients or add value to your clinic, but very quickly transform into a multi-level marketing scam or a Ponzi scheme where you need to onboard more doctors under you and spread the word so that the product can sell better and you can get a better commission. Number 5, and this one is most important, and we are seeing a rise of this recently, losing your control over your digital presence. Many doctors don't realize that due to the way technology works, they already have a Google business listing or a Google Maps listing present, and a scamster takes over that listing because it's not been claimed by the doctor, replacing the phone number there with their personal phone number, with their number, and when a patient contacts that particular place, they end up getting scammed and losing money. So whether you're a doctor, nursing home, dental clinic, polyclinic, it is important to take charge of your digital presence and maintain authenticity, as well as avoid portals where the call from the patient comes to a particular number first and then is often directed to you or diverted to you, because it can always lead to misuse. So keep yourself safe from these scams, and as far as possible use credit cards as the payment method, because just like we have the golden hour, golden window in case of cardiac emergencies, you do have a golden window period where you can stop yourself from this scam by reporting the fraud in time. Now if you use a debit card or net banking or UPI, the money is already debited from your account, but with a credit card you get a buffer zone of for 24 to 48 hours where you can block that particular transaction and not lose money. Check out the caption for more such websites where you can report fraud and certain helpline numbers.